Respected chair and the audience. So I'll be presenting the paper on BYNOCS, which is a novel cloud-based software for binocular vision. It can help improve vision and stereopsis in amblyopia. So I absolutely don't have any financial interest in its either the software or the sale of the product or anything of it. So what is this BYNOCS? It's a uniquely designed and comprehensive cloud-based dioptic therapy software for binocular vision assessment and therapy. And since it's a dioptic software, it employs simultaneous and separate stimulation of both eyes using the anaglyph goggles. So it has diagnostic modules as well as therapeutic modules. The diagnostic modules includes the measurement of heterophoria, accommodation facility, words for dot test, color vision test, and vision tests, and everything like stereopsis and fixation patterns. And the therapeutic modules includes the treatment for asthenopia, for the patients with learning disabilities, and the amblyopia module, which are nothing but the computer-based games which are designed on dioptic stimuli. So this study was aimed to evaluate the effect of this BYNOCS software on visual acuity and stereopsis of amblyopic patients which were aged between 4 to 17 years. So it was a non-randomized, interventional and prospective study. 85 children from my own clinic, so it's a standalone private practice clinic. All children were either anisometropic or ametropic amblyopia. The age group was between 4 to 17. Why not less than 4? Because they were not cooperative for the exercises. And the sex, around 56.5% were males and 43.5% were females. Inclusion criteria, all the patients were diagnosed cases of either anisometropic or ametropic amblyopia, and obviously with associated refractive errors. They had stable vision, meaning thereby there was no improvement with patching on 2 consecutive visits. And they were willing to participate in the study with informed consent. And the exclusion criteria, the patients with strabismic amblyopia or a history of any ocular or retinal pathology or ocular surgery were excluded from the study. Pre-BYNOCS, all the patients were evaluated for complete ophthalmic evaluation with a cycloplegic refraction, best corrected visual acuity with a logMAR and Snellen equivalent, and the BSE was tested using TNO test. Since it's a dioptic software, that's why patching was discontinued during the therapy sessions. And post-BYNOCS, that means 1 month after the therapy session and 3 months after the first visit, that is 4 months after the therapy session. Again, the patients were evaluated for complete ophthalmic evaluation with a cycloplegic refraction, best corrected visual acuity, and BSV or binocular single vision with a TNO test. Since it's a software, what were the system requirements? Since it's a cloud-based software, so that's why it was quite user-friendly. So any desktop or a laptop with a minimum of 11-inch LED screen was sufficient. It required a Google Chrome browser, and many of the times, since the study was undertaken during lockdown, so a Google Meet or Microsoft Teams or a Zoom in which the examiner as well as the patients could be connected remotely. Of course, it required good internet connectivity with a minimum of 512 kbps speed. In the therapy session, the therapist and the patients could connect even remotely with a Google Meet or MS Teams or Zoom. Patients needed to use the anaglyph goggles, which are either red blue or red cyan. It required one-time calibration of the patient's computer for the size and color and also for the anaglyph. And the 30 sessions were given of dioptic therapy, which were given online, and the minimum duration of the treatment was 30 minutes. Observations, it's a whole lot of observations, but what I could observe in the first 1 month as well as 4-month visit was there was definite improvement in vision as well as stereopsis. So of these 85 patients, 48 were male and 37 were female with a mean age of 8.4 years. Pre-therapy, around 22.5% eyes had binocular, best corrected visual acuity of 6, 9 and 6, which increased to 35% post-therapy. So the post-therapy, improvement in distance as well as near vision was statistically significant using Wilcoxon's sign rank test. And interestingly, improvement in stereopsis was also statistically significant using McNamara test. So according to me, what are the advantages of this BYNOCS software? Since it's a cloud-based program, it's quite user-friendly. It can be used as an easy telehealth vision therapy program. It is useful for patching resistant as well as patching non-compliant amblyoptic children. Because of its remote use, it was of good use even in lockdown as well as in COVID pandemic time. It is given as a game sort of thing, so that's why it's quite enjoyable for the children. An examiner can remotely monitor examination as well as the progress of the patient. But of course, there are limitations of the study. It is just a 4-month study, so the long-term results are yet to emerge. Of course, we are now having this conference in very hi-fi, this thing with a good internet connectivity and everything. But it does require internet connection and desktop and laptop. So still in some parts of India, having internet connection desktop is still a distant dream, so it cannot be universally accepted as of now. Efficacy as a primary treatment also yet to be proved, and of course it requires a long-term studies to prove, because if you see the ATS 18 or 20, even the binocular decourage games, the long-term follow-up, it has showed not superior result than patching. So to conclude, BYNOCS, which is a cloud-based dioptic therapy software, it allowed visual acuity and stereopsis of children between age 4 to 17 years to be improved in their homes for 4 months period, and it requires a long-term studies to prove its usefulness as a robust amblyopia treatment option. These are my references. Thank you for kind attention.
It's costly, I think so.
Sorry?
What is the cost per session, madam?
Cost was much higher, but since I had in fact, I'm quite happy to share, because in a single standalone clinical practice, till yesterday I have recruited almost close to 247 to be precise. So since it's a high volume, I could negotiate with these software people okay. And I could just pass on the benefit to the patient. But as you know, in any new treatment, especially for the amblyopia, amongst ophthalmologists there are either two reactions. Once there is a new treatment, either you go behind it, it's all very good treatment, and on the other hand you just discard it because patching is the only treatment. In fact, as a scientific community, we have to evaluate it properly. It should stand the test of time. It should be evaluated in proper statistical methods, and if it is good, I think we can adopt to these treatments. So it will be interesting to see what happens next year.
No, I think in principle it's a good principle. Yeah. Dioptic is the future. Because we are not patching, so we are not removing any fusion of the patient. But there are free, we use a lot of free softwares also which are available online. I think apart from the cost and apart from the fact that it can only incorporate mostly an isometropic amblyopia, though they have a system of adjusting for prisms, it would be too far-fetched to do it for
since it's a dioptic, you need to have straight eyes for that.
You need to have the straight eyes. But I think, and I have used it, I don't think it is very good in, vision deprivation amblyopia, but an isometropic amblyopia, I think it is a fair thing.
So 4-month period, the results were quite satisfactory.
Yes.
But again, whether it is long-lasting, I still don't know. So I'd be happy to share the results next year.
Because should be long-lasting because the stereo acuity is also improving. So which shows that it is bifoveal fixation is also.
So that was quite interesting observation.
You know, we had a Japanese gamer. He used to do virtual games on the world, and he actually worked with the Tokyo Dental College, and he developed a software it's called Blue Vision, BLU, if you go through the net. You must have heard about him. So he worked with us for 4 months in India, and he was very keen to produce this. Results are fantastic, but the cost was coming to about $800 per this thing.
Cost is always.
But because of my high volume, I could negotiate.
Yeah, you're looking for a VC capital or startup funding, which you couldn't get. But the software that he has it's been done in Japan, and about 1,000 children is out of the world. Very well done.
Your follow-up was same as that pattern if you are giving it in the remote, like you're just remotely controlling them.
Sorry, I didn't get.
Follow-up, sir. How was the follow-up done?
Follow-up was done in the clinic.
In the
clinic. That I specifically asked them to do it in the clinic.